Good afternoon, everyone, and welcome to Chef AJ Live. I'm so happy you guys are here. If you're just seeing me for the first time, I've been going live 1 to 3 times a day ever since the sheltering in place started to give you interesting and inspiring interviews with people that I admire, and also just to create a sense of connection and community. And it's been so great because we're seeing so many of the same people on live, and you guys are getting to know each other and helping each other and talking to each other. So today I have the pleasure of introducing Dr. Michele Tollefson. She is a board certified obstetrician and gynecologist. She's also board certified in a wonderful specialty that I hope she'll talk a little bit about called lifestyle medicine. But she's here today also to talk about what it's like being a thriver and survivor of breast cancer that was diagnosed less than a year ago. Please welcome Dr. Tollefson. Thank you so much for being here to tell your story.
Of course. Thank you so much for inviting me to join you today. I'm excited to talk to your viewers and everyone out there about my personal, some parts of my personal health journey, as well as my passion for lifestyle as medicine. So I am going to share my screen and get started talking with you. And I welcome any questions afterwards as well. This is what I'm passionate about, and getting to share this message really is something that I love doing. So lifestyle as medicine. So I want to tell you a story. I want to tell you my story. So I am an obstetrician gynecologist by training, and was in full-time clinical practice and loved it. However, the stress of the operating room, the stress of just that kind of crazy routine, while having my daughter, who's in the picture in the middle, she was just a year and a half when I was in full-time clinical practice, I decided that I wanted a pace that was slower, that in order to improve my own health and well-being, and for the health of my family and for the future children that my husband and I wanted, I decided to look for other ways of sharing my love for health and wellness. And so I was the director of I was the women's health director of a hospital system. And at that time, learned about lifestyle as medicine. I was connected with the Harvard Institute of Lifestyle Medicine, became guest faculty for them. And so I left full-time clinical practice and started teaching at Metropolitan State University of Denver, and brought lifestyle as medicine into the university system. So if we go back about a year ago, so springtime, oh, my apologies.
That's okay.
Springtime 2019.
I'm not seeing, just so you know, I'm not seeing any slides.
Oh, you're not?
I have not seen a slide since you started. I've only seen you.
Oh my goodness. Okay.
So you want to, maybe there's a button on the bottom that says share screen that you want to click.
Oh, I apologize.
That's okay.
Let me try again.
Now we're seeing your slides. Perfect.
Yay. Okay, let's try it. Can you see that now, Chef AJ?
Absolutely. Lifestyle is medicine.
Yay. Okay, so back to OB-GYN practice, and then I moved on to teaching at Metropolitan State University of Denver. So when I was in full-time clinical practice, I had fairly healthy lifestyle behaviors, but I was sleep deprived as an OB-GYN who was delivering babies in the middle of the night, and I had higher levels of stress than I probably should have had. And I was predominantly plant-based or predominantly vegan, but still ate some chicken and still had dairy products now and then. So that was my busy time in full-time clinical practice. So about a decade ago, I switched and went to Metropolitan State University of Denver. But over the course of 10 years, I have transitioned my family to become almost, so we're plant-based, we're whole food plant-based eaters. And so during that time, I was doing healthy lifestyle behaviors. I was exercising at least 30 minutes every day. I was meditating and using other forms of healthy stress reduction. I was optimizing my sleep. I was eating lots and lots of plants and learning how to cook. I didn't know how to cook well back when I was in full-time clinical practice, but that decade of teaching, I had embraced whole food plant-based cooking. So I was doing all of the right things. I had 2 other children. You can see my boys there, Luke and Blake. I breastfed all of my kids for quite a long time, and really felt like I was living a healthy life, a healthy lifestyle. I had recently been elected to be the secretary of the American College of Lifestyle Medicine. And so I was part of the executive board, felt honored to have that position. And our Lifestyle Medicine Bachelor of Science program at Metropolitan State University of Denver had become the first Bachelor of Science in the United States in lifestyle medicine. So things were going really well for me. And I was volunteering, just doing a little bit of office gynecology and lifestyle medicine at a nonprofit clinic. So I am 43, and at age 41 had a normal mammogram, completely normal, the 3D mammogram. And I got a reminder on my phone as I set reminders, busy mom, lots of things going on. And so I set a reminder that it had been a year since my previous mammogram. And I thought, oh, do I call and schedule a mammogram or should I wait? There's a lot of debate going on right now as far as when women should begin mammograms, how frequently they should get their mammograms. And so I had that thought in my head, what should I do? But I decided to go ahead and schedule my mammogram. So 1 year and 1 week after a completely normal mammogram. And so in medicine, we grade mammograms, or not a grade, we give them a score. And so my mammogram on the left had been BI-RADS 1, which is like an A+. Everything looks very normal. And 1 year and 1 week later, my mammogram on the right was taken. And so I got that phone call, the phone call none of us ever want to get. I was actually in the middle of a Zoom meeting teaching. Well, it was a meeting, but I was speaking with other teachers down at Metropolitan State University of Denver. I was on a Zoom meeting and got that call that said something was wrong and that I needed to come in the next morning for more imaging. And
That's
so,
incredible, if you don't mind me interrupting, because
of course,
I mean, you had so many normal mammograms. I mean, this is not something you were expecting, I'm sure.
no.
And would
I
you
was
mind
shocked.
explaining how this particular type of breast cancer is perhaps different than we hear of many different kinds, but this one is
Sure.
different?
Yeah, so this is an invasive ductal carcinoma. It biopsy showed it to be estrogen receptor and progesterone receptor positive, which is the most common type of breast cancer. So ERPR positive. It was a grade 3 stage 2. What was I think more unusual about it was that the oncotype, when they removed it during my mastectomy, which I'm going forward to and then back, but it had an oncotype of 43, which means that it has that it's more aggressive. And so with all of that together, all of that information, and knowing how fast this had grown, I saw multiple surgeons and had a lot of discussion as to what I should do to proceed, whether that would be a lumpectomy or a mastectomy. And both choices are fine. For me, looking at all of the information, I personally decided to go ahead with a bilateral mastectomy. So this was the most shocking phone call of my life. I didn't expect it. I honestly did the why me, right? I went through all those things, like I don't drink alcohol and I exercise 30 minutes a day and I manage my stress and I sleep well and I breastfed all of my kids. And like, I felt like I had been doing all of the right things, and of course not perfect. But I thought I had this kind of belief that I was somewhat indestructible because I did all of those things and did them well. I did my mammogram, but I never expected this. I mean, maybe something super small, but I had no symptoms. I couldn't feel this mass, even though I'm a gynecologist who has done thousands of clinical breast exams. So I was shocked. Did the why me, but then actually while waiting for the biopsy, I started to think, why not me? So 1 in 8 women in the United States will be diagnosed with breast cancer, and so it is very common. And even though eating a whole food plant-based diet, which I firmly believe in, even though eating a whole food plant-based diet, even though a vegan diet decreases our risk of breast cancer, unfortunately, it doesn't eliminate the risk altogether. And so I happen to be that one who got this diagnosis. And so while I was waiting for the biopsy, so I looked at the ultrasound, I knew that it looked bad. I knew that it looked bad and that it was most likely cancer. But I started thinking to myself, if there is any way that I'm going to get myself through this, I have to embrace lifestyle medicine. So lifestyle medicine is the use of evidence-based healthy lifestyle behaviors to prevent, treat, and sometimes reverse chronic disease. And so that's the field that I had been in. That's my area of expertise. And I knew if I am going to make it through, if I'm going to make it through this diagnosis and survive and thrive doing it, I have to embrace everything that I know from lifestyle medicine. So I actually ordered a new broccoli sprout, that growing container from Amazon as I was waiting for my breast biopsy, and thought I'm going to take everything I know about healthy eating, physical activity, and use it as I battle this. So I decided to do a bilateral mastectomy. And also during this, I also thought I want to do everything I can. Like, this diagnosis seemed so meaningless. It seemed so wrong, that I thought if there's anything that I can take from this, if there's anything that I can take from this bad diagnosis in order to help other women, I have to do it. And so I had done some work with the local health news station, and shared my mammograms with the local TV station, in order to help increase awareness about breast cancer, about screening, about prevention, and then treatment. And so I even invited the cameras into the operating room with me. So this is during my mastectomy with my surgeons, the anesthesiologist, and the nurse. But I had a bilateral mastectomy. This is right after my surgery, and with my daughter and my mom, we also had to have the discussions about risk. When someone has a diagnosis such as this, it also brings up familial risk. I did not have a strong family history of breast cancer, nothing that would have put me in an increased risk category. And so having this diagnosis meant that my sisters, my mom, my daughter, we had to have those discussions about what their risks look like as well. I decided, everyone is different. There are different things you can do as far as you have a breast cancer diagnosis and you're going to go through chemotherapy, which I knew that I needed to. I personally felt like I needed to because of my oncotype being so high. I decided I needed to get whatever control I had over this diagnosis and over this journey. And so I got my hair, I got my head shaved before I had a chance to even lose it. I had my chemotherapy port put in, which is still in, and I'll have taken out eventually once the COVID-19 is once it's safer to do so for me. I also used every chance that I had during my whole cancer journey, surgery, and then 16 chemotherapy treatments. I used everything that I could, every opportunity that I could, to help advocate for other breast cancer survivors. I wanted to raise awareness. I wanted to help raise funds if I could for others going through this. I was fortunate enough to have insurance, but the cost of a treatment like this with a diagnosis is immense. And so I wanted to do whatever I could to help raise awareness. I spoke with our local news. I presented at the American College of Lifestyle Medicine. The picture on the left is me presenting in my new pink tennis shoes. I also did some retail therapy and bought some new pink shoes for myself. I tried to embrace it as much as I could while hating going through everything, but wanted to embrace it and to do what I could to advocate for others. I went through 16 rounds of chemotherapy. I would like to say I did the conventional medicine treatment with all the chemotherapy and all of those side effects. I did that. And I also did lifestyle as medicine. And so I took everything that I could find that was evidence-based as far as lifestyle medicine, as far as nutrition and physical activity and stress management and sleep and connections. And I did acupuncture. I'm still doing acupuncture because there's some studies out there as far as neuropathy and that. And I did massage. And so I did biofeedback to help with the stress and learning how to better cope with that. I saw a therapist to talk about the stress. I talked with the navigators about how do I tell my kids about this. I tried to embrace everything I could. You can see those cooling mitts there. I did adriamycin and Cytoxan followed by Taxol treatments, and the Taxol causes some neuropathy. So I did the cryotherapy, or very cold for my hands and feet. I tried to look at all the evidence there was and just to embrace whatever I could to help myself get through this. And even though I'm smiling there were days where I had tears. There there were those why me moments, but I tried to keep coming back to what I knew to be true, that the power of healthy eating in order to fuel my body during that with the most powerful foods I could give it. I exercised at least 30 minutes every day. There's some great research out there on the ability for exercise to help with chemotherapy related fatigue. And so I was at the University of Colorado Wellness Center, their cancer center. They have physical therapists there who design physical activity programs, and I went and exercised with the other people going through cancer treatments as well. I went through that journey. So as I mentioned, these are just some of the different things that I did to support my own health, and that I would encourage people having the ability to have access to. That's one of the things that I found so helpful with the University of Colorado's Wellness Cancer Center, is that I had access to these things. I was able to see my oncologist and go down the hall to a physician who specialized in evidence-based integrative practices in order to support health and well-being. Every time I would go in there, he had a cup of green tea ready for me, and we talked about the power of nutrition and stress reduction, all those things. The next door to him is a nurse who does acupuncture. So it's under that roof where everybody is functioning as a team, an evidence-based integrative health lifestyle medicine team. The dietitian is there, the exercise, the physical therapist is there doing exercise. I also looked at what environmental toxins might be in my surroundings, and looked to see if there could be anything that was an endocrine disrupting chemical that I might be coming in contact with. As I mentioned, this is the actual broccoli sprout growing device that I purchased while waiting for my biopsy that day. The Cancer Fighting Kitchen is a cookbook that I like. I just embraced everything that I could. I teach down at MSU Denver, and these are some of my amazing students. You can see that they have their healthy food there, that they are trying to, their plants, their fruits and vegetables that they are showing have superpowers. I gathered my friends around me, my family, my students, and also use the principle of life design. So I am a fan of Designing Your Life. This is a book, Bill Burnett and Dave Evans, that comes out of Stanford, but it comes out of that design thinking. And so at the university where I teach, we have a Designing Your healthcare career. And but I love this book. And so it talks a lot about design thinking, about how can we kind of take our circumstances and how can we look at moving forward, that there are various paths that we could probably be happy with, and looking at how to move along those paths. And so for me, I wanted to take this diagnosis as a time to, as a teachable moment for myself. So I talk about behavior change and wellness coaching and teachable moments. I talk about that for others, but this diagnosis was a chance for me to have a teachable moment, for me to realize my vulnerability, for me to realize the importance of connecting. I knew that stress management and connection were important, but didn't realize how important. The integrative health physician that I saw at the University of Colorado Cancer Center said, you know a lot about stress reduction, but are you actually doing it? Are you actually doing those practices? It's one thing to know it, but another thing to actually take time for self-care and to do it. And that's
I think that's where they get that saying, physician, heal thyself.
Yes. But also women, after working with women, I'm sure men as well, but there's so many when we're so busy doing different things. We care for others, we give. And so to actually take time for ourselves. And so that teachable moment of what can I learn from this? And if I could, and after reflecting on it, I felt like it was one of my missions in life, or my calling now, to help other people, other women, know that they can take diagnoses, whether that's a diagnosis of diabetes, or whether that's a diagnosis of fibromyalgia, whatever their diagnosis is, that they can take those, or a cancer diagnosis, and how can they use that in order to design a healthier life moving forward from wherever they're at in their journey. So that's a little bit about my journey right now. I finished chemotherapy on Valentine's Day, and I'm moving forward with life, with this kind of new reality, with going through menopause early. I need to do more research and more outreach. I know a lot about menopause from being a gynecologist, but we need even more information out there for women going through menopausal symptoms, because it is chemotherapy threw me into menopause early. So that's a little bit about my story, and I know there are others. We all have stories. I mean, I'm not alone in having gone through stress and trial and everything that comes with a diagnosis like that. We all have our stories, and so if we can, I think, if we can be somewhat vulnerable, which is hard for me, hard for others, but if we can connect through some of what we've been through, if we can try to realize that there are all areas that we need to improve upon, that wellness is it's a whole person wellness, it's mind, body, and spirit. So that's my mission moving forward. I'd love to spend a couple of minutes talking about the American College of Lifestyle Medicine. So it's a group, it's a professional organization. There are more than 4,000 active members. There are about half of us are physicians, and the other half are wellness coaches and nurses and physical therapists and dentists and pharmacists and people in public health, and just a variety of people in health-related fields who believe in the power of lifestyle medicine, who believe in the need for evidence-based healthy lifestyle practices, and to bring that to the forefront rather than it being an afterthought of pills first and then healthy lifestyle as an afterthought. What we're trying to do is we're trying to say healthy lifestyle practices need to be the foundation for healthcare. And we can still have surgery, like my mastectomy, we can still have pills when needed, but hopefully we can use lifestyle as medicine to prevent and then treat and sometimes reverse chronic disease. So the American College of Lifestyle Medicine is this professional organization. We have the 6 pillars of lifestyle medicine. So healthful eating of whole food, plant-based diet, increased physical activity, developing healthy ways to manage stress resilience, avoiding risky substances, improving sleep, and then forming and maintaining relationships. That those connections are incredibly important, and that often has been pushed to the side of healthcare rather than coming to the forefront. So as I mentioned before, there's the definition, but it's the use of lifestyle therapeutic approaches that are evidence-based, that whole food, plant predominant dietary lifestyle with physical activity and sleep and stress management, and to pursue other non-drug modalities to treat, reverse, and prevent chronic disease using those other medications and drug modalities and surgeries when needed. And lifestyle medicine is validated as highly effective. It addresses the root cause of disease. It doesn't just treat the symptoms. It tries to look at the root cause. We believe that there are better outcomes and lower costs. It's really a value-based care. We spend such a significant part of our gross domestic product here in the United States on treating chronic diseases that have a significant root in lifestyle behaviors. And so we really need lifestyle medicine in order to help our healthcare system. It's about patient-centered care. It's about healing. It's about engaging patients rather than patients just being a bystander and taking their prescription and that's it. It's really about engaging those patients and meeting them where they're at. Oh, this slide looks a little bit funny, at least on my screen. Anyway, simple but powerful therapy. Often we think of healthy eating and it's like, oh, you need to eat healthy or you need to get some exercise in, but really, it's culinary medicine. It's cooking as medicine. It's food as medicine. Food is powerful medicine. It's not just this thing on the side. But you know that, Chef AJ. I think you know, your viewers know that better than most. But even exercise is powerful medicine. And so how do we bring this to the forefront of healthcare? So the American College of Lifestyle Medicine growth has been exponential. If any of you are interested in getting involved, check out the American College of Lifestyle Medicine and reach out to me. I am the founding co-chair of the Women's Health Member Interest Group. There are over 100 members, and the founding co-chair of the Pre-Professional Lifestyle Medicine Education Member Interest Group. So the American College of Lifestyle Medicine, if you want more information, we'll give you the link and feel free to reach out. I'm super passionate about it and love talking to anybody who wants to talk lifestyle medicine. I also had the privilege of starting the first Bachelor of Science in the United States, in the world that we know of, in lifestyle medicine. And it's at Metropolitan State University of Denver, where I started teaching about a decade ago. We train health practitioners and people who are not from health backgrounds to be health and wellness coaches, where they take 3 courses and can take the National Board for Health and Wellness Coaching exam. I teach stress and sleep classes, lifestyle medicine across gender and lifespan. But we really are trying to elevate the health of Coloradoans, but also the whole world. And our classes are all available online with concurrent online learning and some asynchronous, so synchronous and asynchronous. But we have a lot of different classes. It started as a single class and it turned into a movement. Now we have incredible growth and incredible excitement. Our students are out doing amazing things. We have a very diverse student population in the lifestyle medicine classes. I have some students who are right out of high school. I have some students who are in their 60s, 70s, and 80s. I have lawyers and doctors taking classes alongside retired nurses and respiratory therapists. So it's this, and a lot of wellness coaches and people wanting to be wellness coaches, but it really is this group coming together in order to help and heal. We know healthcare is expanding. This is Nancy Ray Kochi. She is a Native American she was the first graduate with lifestyle medicine and took the importance of eating more plants and whole foods and the importance of healthy eating and exercise and stress, and took it back to her community and is doing amazing things. So that's a little bit about me and my two organizations that I love and my kiddos. I just had my 43rd birthday and love cooking my whole food plant-based meals. I love cooking now. I love trying new things. My whole family is whole food plant-based. I love teaching at Lifestyle Medicine at MSU Denver. I love the American College of Lifestyle Medicine. And I'm happy to take any questions and to share more information with you about anything that I know. So thank you so much for having me, Chef AJ. I get excited and I talk fast, so hopefully that was okay.
Because that your passion is contagious, and that's what people are saying, that they love your passion and how you took the disease and turned it around and used it as a way to help others. So yes, there definitely are some questions, and I will find them in the feed. But
Sure.
while I'm doing that, I'll ask my question. Why do you think there's such a disconnect with diet and disease in general, but specifically with cancer? And the reason I say that is up until a year ago when I moved here, I still volunteer doing what's called, well, not now, nobody's volunteering, but when we are sheltering, I do something called animal assisted therapy at the hospital where I visit patients. But when I was in LA, I specifically visited the infusion center. So because these people were there all day, so it was made for great visits. They were bored. I could talk to them, and the dog could sit on their lap, and we would have nice conversations. I'd see them sometimes, several times a month if they were getting multiple chemotherapy sessions like you. And while I was there, they would always come and bring them lunch, and they would have a choice of a turkey sandwich, a ham sandwich, or a cheese sandwich on white bread, their choice of chips, and of course their choice of soda. And as a volunteer, I was never allowed to say anything. But I would say something like, "Oh, did your doctor ever talk to you about that?" "Oh, my oncologist says I got cancer. I can eat anything I want. I should." So doesn't that kind of drive you crazy a little?
It does. Yes. Whether it's a cancer diagnosis or otherwise, I went to pick up my my husband's uncle, who we help care for, who has dementia after his stent, and he had been served at a hospital I think it was a hamburger. It was something very unhealthy. I don't remember exactly what it was, but it was the chips. It was the processed meat. So it does drive me crazy. I am right with you there. But I believe things are changing. So back when I was part of the American College of Lifestyle Medicine over a decade ago, things seemed very heavy. Like, are we really going to be able to make a change? But now I believe there's more hope than ever. There are hospital systems that are embracing whole food, plant-based ways of eating as never before. And also, I was pleased to see when I went to the University of Colorado Health System that their dietitians were talking about the importance of eating more whole foods, of eating more plants, of fiber. And so I felt I wanted to make an appointment with the dietitians because I thought maybe there's something out there that I haven't heard. I want to hear from the experts. And I was very excited. I can't speak for all systems, of course, but I was very excited to see how they were the ones who actually suggested that book that I showed earlier, but to show a plant predominant way of eating, which was great. And so I think there's that whole spectrum, and I think that they're trying. It's my sense that that we're trying to move the needle more towards whole food, plant-based. And so of course, as somebody who's passionate about it and who is immersed in the literature, I want that needle to move for everybody all the way over here so that we're all embracing it, because I want everybody to feel and experience the power of a whole food, plant-based way of eating. But I really felt like that there's a lot out there now that is really trying to move that needle. But of course, there's so much work to be done. That's one of the reasons I'm so proud to be part of the American College of Lifestyle Medicine, though, is that we're working on policy. We are working on those things. Brooklyn Borough President Eric Adams, I believe it is, was at the last American College of Lifestyle Medicine conference talking about the amazing work he's doing. I mean, there's just leaders who are pushing for this. We are passionate, and but I'm right there with you.
Well, I just interviewed Eric Adams and he was fantastic.
Did you?
Yeah, he was delightful. Gina asks if you or any of the members of your family ever had genetic testing either before or after your diagnosis.
Yeah. So before, no, we didn't have anything that would have suggested that we needed testing. And I did have genetic testing after my diagnosis, and I'm BRCA negative, the BRCA gene. And so I know, so that is reassuring because it showed that my family members don't have as high of a risk as they would if I had the BRCA gene. However, there's the genetic testing of the oncotype of the actual tumor that showed that was real aggressive with a 43. However, even with the genetic testing being negative, I think too many people think that that's negative, and so there's not a genetic risk, and there's, we're home free. However, there's so much that can be done with eating a whole food, plant predominant diet, exercise, avoiding alcohol or in moderation, but really all of those different healthy lifestyle practices can do such an amazing job of lowering the incidence of breast cancer. So even though the BRCA was negative, we're still plant predominant and believe it's more important now than ever.
Right. Kimberly wants to know, how do you feel about drugs used for breast cancer survivors like tamoxifen?
Yeah. So I personally am on, it's not tamoxifen, but it's something in one of the families that, looking like that family of drugs, that is best for my type of cancer. So one of the wonderful things about cancer research is that we have tons of data. And so we're able to see, okay, for this type of cancer at this grade and this stage and these genetic tests, we believe that this treatment is what gives us the highest chance of long-term survivorship and thriving. And so I am taking one of those medications. However, I believe that I need all of the different lifestyle behaviors, healthy eating just as much because of it. So that's where I personally don't believe it's one or the other. There's some people who are in the camp of it's just chemo and medications, and there are side effects. Believe me, there are yucky side effects, and I wish that this had never happened. I needed to take those, but for me, it's what I decided to do. But lifestyle is needed as well. So yeah.
Is there a certain age after which, I mean, because you're also a gynecologist and obstetrician,
Yeah.
Is there a certain age at which we no longer need mammograms or say even pap smears?
Yeah. So there is debate about when we can stop mammograms and when we start mammograms. So screening, there are several different organizations which have different recommendations as far as screenings. The American College of OB-GYN, and I'm part of that American College of OB-GYNs, still recommends that they have the discussion with their healthcare provider at age 40 to talk about if they want to begin mammograms or not, and then that they should have the ability to, or have the opportunity to have them annually if they choose to do so, or every other year. And so it's a difficult question. Quite honestly, I was debating, do I want to have the mammogram right out, a year after my last mammogram, or should I wait until 2 years? And even thinking about what if I had waited, oh my goodness. But we don't base our recommendations on that one person like me. We base our recommendations on looking at data. And so, I mean, if there's someone, my thought and this is just my own, personal thought, when I'm seeing somebody in the clinic, I talk to them about if you were to have a mammogram that showed something abnormal, would you want to do treatment? And so if there's somebody who is very old, but who is still is healthy, would want to pursue aggressive treatment if they found out something was abnormal, then I recommend it. But it really has to be an individual decision. Also, it's based on, you can look at several different factors that look at a woman's risk of breast cancer to decide how early to start, how frequently, all of those different things. So more than anything, I encourage you to see your healthcare practitioner, to see them, to find someone who you can have that honest dialogue with. I know that there are many women who are opposed to mammograms, and I often found that they would stay away from having those conversations, or would stay away from seeing their health provider. Please see your healthcare provider. Have those conversations. If you should never have a healthcare provider that you feel is making you do something. You should be able to have that dialogue, that discussion. What are my risks and benefits of using a medication? What are my risks and benefits of this screening test? Because there are risks to procedures and drugs as well. So yeah, and I'm having a hot flash right now. I'm sweating. Woo! Early menopause. Yeah, we'll have to talk some other time about menopause. And
I would love to, Dr. Tollefson, because so many women are struggling before, during, and after with that.
Yes,
and especially one of the things is their weight. I've met a lot of people. A lot of people have been overweight much of their life, but then you have women that, and they're just shocked because they've never been overweight. Now they are, and they're like, "What the heck?" Were you ever overweight?
I think I've always been in the normal range, though probably towards the heavier end of the normal range than I would have liked to have been. And so, yeah, we know that excess weight is associated with an increased risk of postmenopausal breast cancer. It's actually not a risk factor for premenopausal breast cancer. So I've been in what's considered a normal weight range, but have fluctuated in that. But we know that one of the things that is important for long-term health with a breast cancer diagnosis, one of the things that helps to decrease the chances of recurrence is maintaining a healthy weight. And that does become more difficult. The drugs that I'm on, the drugs that I've been on, the Zometa, some of the different injections make it hard. The steroids that I had to take make it really hard. So that's something that I'm dealing with, trying to do all that I can in order to maintain a healthy weight. I want to be here to see my grandkids and to do all of those different things. And so in addition to just feeling much better when I'm at a healthy weight and when I eat my healthy foods, I'm doing it also because I want to be here a long time.
I got 2 words for you: calorie density.
Yeah. Yes.
That is, I interviewed a young lady, maybe it was earlier, in quarantine, I'm losing track of days and times, but with brain cancer. And, I think your attitude is so, don't you feel that contributed to your success, that you just didn't say, "Oh gosh, I can't, poor me, I'm going to die," that you just, the way you're reacting to it is helping you get better?
So definitely, that's one of the things, like even when I was first diagnosed, I kept hearing, "I'm so sorry," from my colleagues, from my well-meaning colleagues in the hospital, the people who I had worked with for years. I kept hearing, "I'm so sorry, I'm so sorry." And every time I heard it, I felt a little bit smaller, and I felt like the diagnosis was a little bit worse. And I felt like, oh my goodness, like this maybe, it just minimized me. It minimized my power. And they had the best of intentions, beautiful people. But that's where I said, I have to focus on what I can do. I have to focus on what I can do. I have to focus on my healthy eating. And that's where, like, even though I was already whole food, plant-based and cooking, I thought, what else can I learn? What else can I do? How can I be even healthier? As far as exercise, I knew that chemo was going to be tough, and I wanted to go see those exercise experts and say, how can I do everything that's out there as far as the evidence in order to help me get through that? And I saw a counselor. I did the biofeedback to learn more about managing my stress. And I just thought, I'm in for a fight, or in for a battle. And I want everybody on my team. I need it all. And so for me, that was my way of the more that I was able to do, it was empowering to me, and it helped me. It helped my attitude every time I was able to do something, even though it was small. There were some days when I would exercise, and it was like the wimpiest exercise ever. I would slowly pedal with like no resistance on my bike, and I would, during chemotherapy, there were days where I was like, oh, nothing tastes good, and I would eat my whole food, plant-based, whatever. The meal train that was started, my sister and was able to tell people, we follow whole food plant-based eating. But it helped. All of those things helped my attitude. It was really using lifestyles medicine that helped my attitude. And that's where I felt like I had to tell other people, like I cancer was horrible. Cancer is horrible. There's no way around it. And the treatment and the drugs and the surgery, it's all bad. But if we can spread the message to people about how much power they have, because cancer can be a really disempowering diagnosis. And so the more that we can do to tell people, yes, you may have this new diagnosis of this or that, or things you can't control. However, you have so much power. We need to empower people with all that they can do in order to help themselves through that journey, through chemotherapy, through surgery, but not just breast cancer, but all different types of health journeys of crisis. I mean, that's even now in a time of the pandemic of COVID-19. I mean, we're bringing all these resources together. I mean, that's, like I'm asking my friends, I'm asking my family, I'm asking my patients, are you getting your physical activity, and what are you eating? How are you managing your stress? Connections is incredibly important, the power of connection and interacting. And if we don't do those things, then that's, that can have a real negative impact on our health.
It sounds to me like you have a book in your future.
No, I like speaking with people. I'm not a writer. It's not my passion, but speaking with people and connecting with others, that gets me excited. So thank you for this opportunity.
Oh, my pleasure. Susie has a question that was actually, I was going to ask next. She says, what should people say instead of sorry? Sorry is a normal reaction. And I asked that to Sarah, who has brain cancer, because like when somebody tells me, friend, family member, or even just an acquaintance, that they're sick, and what are you supposed to say to people to make them feel better?
Yeah. No, that is a great question. That's a great question. And I'm sure that I've said I'm sorry to others too. So I think, good question. I haven't thought of this way yet, but I think maybe it's that, it's that just sharing with them that's horrible. And so maybe it is, I'm sorry. But then I think that if we're able to help say, like, that's horrible, you're going through that, and oh my goodness, my heart aches for you. Is there anything that I can do to support you and your health, whether it's physical health, whether it's emotional health? Is there anything that I can support you during this difficult, during this horrible time? But I don't know. I know I'm sorry is a fine reaction. For me, it made me just want to curl up and feel like I couldn't do anything.
I know. You don't want to say like hip hip hooray. I mean, it's really hard, Sharon wants to know what you do for stress management now.
Oh my goodness. I feel like I've tried everything. I really think of stress management as a toolbox. And so when I was going through OB-GYN residency, it was so incredibly stressful. And that's when I realized I needed to learn more about what was out there. And so I feel like I've used most everything. I have a strong spiritual foundation, and so my spirituality helps me with stress management. There's the mindfulness-based stress reduction, MBSR, which I've done training in. I've had the privilege to meet Dr. Herbert Benson, who's at the Mind Body Institute out around Harvard, and they have some excellent resources. The Greater Good Science Center has amazing suggestions as well out of Berkeley. But personally, so I use mindfulness. I like fidget toys. I know that exercise is probably our most evidence-based way of helping to manage stress. So I have to exercise, and I'm not someone who loves to exercise and loves to sweat, but I do it. I know that exercise is powerful medicine, and Dr. Edward Phillips, I believe it was him who may have said this, but he's the one who says, like, exercise is powerful medicine, and exercise is probably the most I think it's him or someone very knowledgeable said exercise is probably the most underused antidepressant. And so that's really good for stress and for mood. So my spiritual practice, healthy eating, I do some mindfulness type of meditation. So not connected with a certain spiritual practice, but just mindfulness meditation, deep breathing. I go to breathing all of the time, just refocusing on my breath. In fact, I have my 4-year-old today was upset, and my 7-year-old helped to calm him down and said, can you take some deep breaths? So we have like a calming corner where we have different things we focus on breath to help with that relaxation response. It's really anything that gets us in the relaxation response that helps us to engage the parasympathetic nervous system. So we're in that fight or flight, and to help us go back to that tend and befriend or to calm down. And so for some people that's going on a long jog, for some people that's a warm bath, for some people it's reading. I know recently I've felt the need in order to disengage from the news, just because I can tell. So like for me, that's been something to help with my stress, is just turning the news off or saying I'm not going to check in with that all of the time, because sometimes the news can be very stressful. But it really is aromatherapy can be great, or finding something that's relaxing, laying down and deep breathing. There's progressive muscle relaxation. There are great resources on YouTube where you can look at progressive muscle relaxation videos where you're tensing and relaxing and tensing and relaxing. Even doing hand massage, you can look at for videos on doing hand massage, some tea. I mean, just all different practices like that. So I think of stress management as this big toolbox, and there are many experts out there, but it's really trying different things and seeing what works best for you. And I also love if you have a journal where you can journal what works for you. And I use that with my patients with all different things, whether that's physical activity, try different things. What resonates with you? What do you like? Try, and I'm sure that Chef AJ, try different foods. What works for you and what doesn't? What do you like? What do you not like? It's the same is true for stress management and being more stress resilient. Try different things and see what resonates with you. But I use everything.
That's terrific. Janet says, I love listening to her upbeat and motivational message. Sharon says she has it all in place. Very inspiring. Everything you're talking about, diet, sleep, exercise, connection, stress management, this is just for everyone, whether they have cancer or not, and for every disease as well. I mean, there's things we have to do every day if we want to survive this world.
That's right. And that's really why the American College of Lifestyle Medicine is saying this can't be an afterthought. It can't be that we focus our healthcare system on just drugs and procedures. They have their place. I believe in them. They have their place, but that we have to bring healthy lifestyles to the forefront in order to prevent and treat and reverse so many of our chronic diseases, those non-communicable or non-infectious diseases, type 2 diabetes and obesity, hyperlipidemia, high cholesterol, all of those different things. There is such power in our lifestyle behaviors, and and those lifestyle behaviors have really been minimized to the side, but the American College of Lifestyle Medicine is saying they are here. And also it's what patients want. It's what we need. Patients are asking for it. They want it. Healthcare providers want it for themselves and want to share it with others. I think there's so many healthcare providers who are burnt out, who feel like they went into this practice because they wanted to provide health care, and instead they feel like they're stuck in just doing electronic records and just prescribing and just kind of in that vicious cycle. And so lifestyle medicine helps to connect us with health. It helps to connect us with what we can do to treat the cause. When we do it, we feel better for ourselves, and then we're able to take that and to share it with others. But physicians only have, I believe it's on average about 19 hours of education and nutrition in medical school, and we're working to change that. We are actively working with the American College of Lifestyle Medicine and making strides. But we have to have physicians thinking different about the power of nutrition and the rest of the lifestyle medicine pillars. And that's why we're saying lifestyle medicine, it's now being taught in quite a few of the medical schools. We have continuing medical education and the residency programs and fellowships, but we're saying it's not just for doctors. Really, lifestyle as medicine needs to be taught to people going into pharmacy school and dentistry and physical therapy and nursing and PT and our paramedics. Like we need the whole healthcare system to be on board. We need everyone. It's true health care for the world. And so that's what we're trying to do lifestyle medicine education for, I guess, for everyone. It treats us and allows us to treat others. But you're right, it's for everyone. It's not just for people who have a cancer diagnosis or who are trying to decrease their chances of it. Lifestyle as medicine needs to be the way we live. It needs to be the foundation, because when we have our healthy lifestyle in place, the other things are easier, such as going through a cancer diagnosis, such as going through the time of the COVID pandemic and all that comes along with that stress as well. But we are being careful with lifestyle as medicine. Healthy lifestyle behaviors do increase immunity, but we're being careful to say, of course, we still need to socially distance and wear our masks and do all of those things. But lifestyle medicine helps so many different body systems and areas.
Absolutely. Well, prevention is the cure. I can't believe you went through 16 rounds. I mean, I can't even imagine one. And that's, you are a real trooper. I mean,
no, it's the power of lifestyle medicine and my faith and family, kind of all of those different things together. When we're in a battle, whatever that is, I mean, and that's where being a gynecologist, you hear a lot of people's stories, and you get real personal with people pretty fast, where they tell you their tough things they've been through. And so I really feel like it's whatever people are going through, the more that we can use whole health, our evidence-based lifestyle practices to support our mental health, our physical health, and to support one another. We need that, and we need it as a world. There's the American College of Lifestyle Medicine, but we also have the international. There's an international, so it's global. The world needs this. It used to be that many of our lifestyle-related diseases were just in the United States, or that they were much higher incidence in more of the affluent countries. But now this unhealthy lifestyle has spread. The standard American diet, the SAD diet, has spread. And so now we need lifestyle medicine to spread in order to help heal not just ourselves, not just the United States, but really to help heal the world.
Right. Rosemary says, amazing woman, so inspirational. You know, as a practicing OBGYN doctor, have you noticed like increase in weight among your patients and more difficult labors and deliveries because of that?
Sure. No, that's a great question. So I haven't practiced obstetrics for about a decade now, but I'm involved in the, I guess, in the education, in the advocacy work, and the work within the American College of Lifestyle Medicine. So from an OB standpoint, yes, we have seen weight increase, and it does, along with excess weight in pregnant women come additional risks for the pregnant mom as well as the fetus. And so that's something that we are actively addressing. We're actually right now with the American College of Lifestyle Medicine, we'll eventually have a lifestyle medicine course that comes out that focuses around women's reproductive health, and then prior to conception and beyond. But yes, we need to address the importance of healthy lifestyle behaviors on women's health. Lifestyle behaviors, especially what we eat, is so connected to our hormones. If we don't, the easiest way that I try to help people think about it is we have this estrogen. Our fat cells produce estrogen. Our ovaries produce estrogen prior to menopause. And we want to have a certain amount of it. A certain amount is good. It actually protects our heart, but in our bones and on and on. But too much is a bad thing. And so we need fiber in order to pull that estrogen and help it be deposited in the toilet. We need that fiber. Otherwise, what happens is the estrogen comes in. We have the estrogen and it's ready to be deposited. And if we do not have enough fiber, then what happens is that estrogen gets recirculated in the body. And so it just keeps recirculating, and it can't, without that fiber, it's not going to be able to properly exit the body in stool and in feces. And so that's one of the things we're seeing is, as we see excess weight, more fat cells producing extra estrogen, we see more and more some of these chronic diseases, and then also a lack of enough fiber, which of course comes from plants, leads to excess weight as well. So eat plants, fiber. I get very excited about fiber and plants and its ability to help keep estrogen where it should be rather than it going too high.
Well, you're a woman after my own heart. I love people that get excited about fiber.
Yay!
Jesse says, I really appreciate the fact that Dr. Tollefson can present such a personal experience in such an informative and objective way. She is a very effective speaker, and Gina says she is so courageous. So again, the question on pap smears, what age do we start? What age can we finally stop?
Yeah, so with pap smears, there are certain groups that are outside of the typical range, but usually most women were saying to start at age 21. And then usually at about age 65 is when they can be discontinued, but really it needs to be a woman talking with her gynecologist, because we have to have so many that are negative and normal before we say that they can be discontinued. We used to say pap smears needed to be done every year, but that was because that was before we had the human papilloma virus testing. Now we're able to actually look for to see if somebody has that virus. So in addition to a pap smear, the pap smear is taking the cells from the surface of the cervix and looking at them under a microscope to say, do those cells look normal or abnormal? Are they precancer, so they look like they're behaving in an abnormal way? The HPV test, we're actually able to check to see if somebody has the human papilloma virus, which is a really common virus that is sexually transmitted. I believe the majority of most reproductive, beyond reproductive age women have been exposed to it at some time. And so if somebody has high risk HPV, it's not all HPV that gives us a really high chance of cervical cancer, but those high risk HPV do. And so we're able to do a pap smear and look to see if somebody has high risk HPV. And then based upon that, we can decide how frequently they need to come in for testing. One really interesting thing though, is that once again, teachable moment. So if somebody has an abnormal pap smear, I may be one of the only doctors who gets excited to talk about nutrition with them, because if somebody has an abnormal pap smear, it is a perfect time to say, what can you do to improve your immunity? What are you doing? And so if we're able to talk to somebody about the immune system and how they can get their phytochemicals from their plants, from a whole food plant-based diet, if we can talk to somebody about cutting out the processed food, and then tobacco use is huge. Anything we can do to help strengthen somebody's immunity is going to give them a better chance of clearing that infection so that it doesn't progress on to cervical cancer. However, even though I'm a proponent of plants, I say too, though, that if somebody has an abnormal pap smear, or even if they don't and they're eating just plants, you need to come in for your regular screening. So I would say start at 21. Usually, often you can stop at 65, but you need that conversation with your primary care provider to make those decisions.
Great. Kathy says, are you a proponent of the HPV vaccine for young women? And Kimberly says, how do they do the testing for HPV? Is it done the same time as the pap smear?
Yeah, no, good questions. So yes, the HPV test can be done at the same time as the pap smear. You can just, the little brush that collects the cells for the pap smear. They can also do the HPV testing right off of that. So it can be done at the same time. No special, nothing else is needed other than us letting the lab know what we want them to run. And then the HPV vaccine. That is controversial. Vaccines are controversial. I will say that I personally am an advocate for the vaccine. I have looked at the evidence. I've looked at the evidence as far as what I see in the literature, American College of OB-GYNs, and I am an advocate for the HPV vaccine. But I do know that there are a lot of people who are opposed to vaccines, and I respect others' opinions. But I believe I'm also the one who is, I've seen women die from cervical cancer. And so I think that when you see that, it makes it very real. And so I am an advocate for it. And if somebody's getting it, it makes sense to get it early before there's ever any sexual activity or exposure, because then you can prevent somebody from even getting that virus, or decrease the chances of somebody getting those high risk virus strains in the first place. Whereas if you wait until somebody is older, if there's any chance that they happen to be exposed, then you decrease the efficacy of it. So once again, I know vaccines are controversial, but I personally am an advocate for the HPV vaccine in young women.
Terrific. Sherry wants to know, which is better, a digital mammogram or a regular traditional mammogram? And what about people that don't want mammograms? Are there other screening options?
Yeah, good questions as well. So those images that I showed you early on, those were 3D mammograms. Those are high quality 3D mammograms. And they give the radiologist a better, I guess, a clearer picture where they're able to kind of like go through it and look at it and see things more clearly. So I like 3D mammograms if it's affordable, if it is covered, if a woman has access to it. However, if somebody does not, regular mammograms are very good as well. There's always that risk of having a mammogram and then needing to go back in because they didn't see something as well. And so that's where if we're able to get really good images the first time, hopefully we can decrease the chances of somebody having to worry and wait to come in for re-imaging. So yes, I recommend mammograms whether they're the regular ones or whether they're the 3D ones. 3D are preferable, but regular are still fine as well. And what about not getting mammograms? So it's a difficult, so personally, even before this diagnosis, I'm a strong advocate for mammograms. I'd recommend that the women start them at age 40, but I know that there are different societies that are saying that they can be started later. And so I think that's fine as well if somebody has that discussion with their primary care provider. However, there are some women who are opposed to getting mammograms, or who say, I won't get a mammogram. And I've seen them as patients. I've seen them as patients before. And so I think then it's a discussion as to are there other alternatives? And there aren't any alternatives that are as good as a mammogram, in my opinion. So for the amount of radiation exposure that you get in a mammogram, the potential upside of a life saved and being able to catch something early, to me, the benefits outweigh the risks. However, if somebody chooses not to do that, what else can be done? Can someone go in more frequently for clinical breast exams? There are some people who, there's thermography, there's using ultrasounds, there's using MRI. So there are other options. We have some different things. Will insurers pay for that or not? When really our gold standard right now is the mammogram, and it definitely is what I and other healthcare leaders, the majority, recommend. The other alternatives, we just haven't seen. We haven't seen the literature, but I do know that I know that it is a controversial topic, and I would encourage you to find a healthcare provider where you can have that honest discussion, where you can look at for yourself. There's some different models. What is your risk of getting breast cancer in the next X number of years? And what is your risk from getting a mammogram? Because just because you get a mammogram doesn't mean you have to come in every single year and get a mammogram. That's when you have that discussion with your doctor about, how often. And so nothing is set in stone, but I personally am an advocate for mammograms.
That's terrific. Jessie says, I have a vegan friend who survived ovarian cancer in 2015, but was told by her doctors that while being treated, she absolutely had to eat animal protein. Did you ever run into anything like this?
No, I never ran into anyone who said that I needed to eat animal protein. At least during my treatment. I mean, I believe that the dietitians now and the health providers, at least the ones that I interacted with, were knowledgeable enough about the various sources of plant-based protein that they didn't have a concern about that. But I do know we need more education. We need more education, and the American College of Lifestyle Medicine. So one of the things that I did, I co-chair the Women's Health Member Interest Group, and I co-chair the Pre-Professional Lifestyle Medicine Education Member Interest Group. But after I got diagnosed with cancer, I said I need to join the ACLM Cancer Member Interest Group, and so I joined it as well. And so they are amazing. They're amazing oncologists, and we have gynecologic oncologists. We have oncologists everywhere from anywhere. Harvard to Loma Linda, everywhere. And so they're doing a lot to advocate for knowledge about the importance of a whole food plant-based diet in a variety of different conditions, but a variety of different cancer diagnoses.
Right. Thank you.
And the dietitian should be able to work with that too. So that's where I saw a dietitian, and I guess there may be certain conditions or where they're looking at and you need this or that, but I didn't hear anybody say you need animal-based protein. Yeah.
Right. Terrific. Frankie says, lovely lady. We like her spirit. A lot of questions on HRT and other, but I think I've kept you long enough, and we can always have you back and talk about menopause. But I'd like to end with kind of a fun question from Ava. What do you eat every day?
Yes. Oh, I eat a variety of different things. It's one of the having there. Oh, sorry, my screen went black. So, so I love to cook. And so every weekend, oh, sorry, my internet is kind of acting funny. Every weekend we try to choose recipes that we'll make, and we do a lot of meal prep on the weekend. So I have a busy family. So like we do a lot of curries, and oh my goodness, we're always experimenting. We have a Pinterest board with all of our favorite recipes, and we just try lots of different things. So yeah.
That's terrific. It's
I
been
know. So I don't know the typical smoothie, but we do fun salads, and then we always we cook in bulk and then take some over to my parents' house, and we have my whole family is whole food plant predominant. So yeah, I think we have a curry chickpea in the refrigerator right now, as well as as well as we took some of our some soup recipes, and we have veganized them, like my husband's father's old chili recipe. We now have veganized that, and we're getting good at being creative and just a variety of different recipes. So
Kathy wants to know what your Pinterest ID is.
Well, I don't even know. I am not very social media savvy, but I need to become more social media savvy. But I just put them all on a personal board, but I should look into sharing. I'm very open to sharing. I just don't have that tech savvy.
You got to get a social media person. I'm getting one of these days because I can't keep up either. I can't even answer the YouTube comments as it is. So we just want to share a couple of more nice comments about you. Louise says, I love that she is into the combination of all preventative measures and lifestyle medicine. Love. And Jessie says, thank you, Dr. Tollefson. I'm hopeful that your personal and professional experience will help to change the nutritional approach to cancer treatment. And Kimberly says, thank you. Great interview. This went very fast. You're very easy to listen to because you're so passionate.
Oh, thank you. This was fun. Yeah, no, I love talking about menopause and sexual health and all different things. So I'll come back and chat with you anytime.
That would be great. Well, we love sexual health because earlier today I had Dr. Terry Mason, a urologist from the movie Forks Over Knives, and he talked about men's sexual health. So we have to give the ladies equal time. And
that's right. Most definitely.
Everybody's got boobs, because I even had a male friend who had breast cancer.
Yes.
Everybody's got boobies.
Yep, most definitely.
Kathy says, tell her she is beautiful. You are beautiful. Paul says, you're an amazing lady. And Gina says, I find the best people. You bet. I love interviewing all the usual suspects, but there's a lot of great people there in the plant-based world, even some who aren't plant-based. Like you said, plant predominant, that's a new word to me. And that's why I'm here every day, at least once a day while we're sheltering. And I'm having such a good time doing this that I might keep going after sheltering is not even a thing. But for now, we'll be here every day. And if you come back tomorrow, at 2 p.m., we have Dr. Frank Sabatino, who went on for 90 minutes last week and still didn't get to all your questions, so he's coming back. And at 4 o'clock tomorrow, we have Colin McCullough, who's doing a cooking demo with recipes from his new book. Sunday at 11 a.m., Dr. Alan Goldhammer is going to be talking about is what you eat important to your immunity? And at 2 p.m., Dr. Cyrus Kambata from Mastering Diabetes. So thank you so much, Dr. Tollefson. I wish you, I don't want to say I'm sorry. I just want to say you're awesome, because now I know we should say, how can I support you? How can I support you in this? And that's what I'd like to say. How can we support you in this? I think we can support you by getting the word out about the American College of Lifestyle Medicine, whose link I have been posting several times. They have annual conferences, and you can become a member, and they do wonderful webinars every month that are free if you get on their mailing list. So please check them out. And thank you so much for what you're doing to make people aware of you can not only survive cancer, but you can thrive with cancer.
Most definitely. Thank you so much. Thank you.
Absolutely.
Lovely
Take care,
weekend.
everybody. See you tomorrow. Bye.
Bye.